So what happens when there's a long-term care outbreak?
So it's a bit complicated, so I'm going to try to break it down into various steps. So first we get notified that there's a positive patient that tested for COVID-19. That often gets phoned to us, or we can pick it up through our electronic monitoring system. We would form a team to investigate that if we get notified of a positive case. We'd want to certainly make sure it's the right patient with the right information at the right location. And then we have to differentiate it as a staff person or is it a resident that tested positive. Clearly, if we're confident the right person with the right test, that person has to be isolated for 10 days. And for the most part, if they're healthy, they will stop shedding virus after 10 days, but they have to be kept separate away from other people in the community. We then do a risk assessment because we want to make sure that no one else in that facility is at risk, whether it's a staff person and or a resident. So we would try to understand how has that person moved within the facility. Did they have personal protective equipment on and did they wear it appropriately? What other procedures and practices did the facility have in place for infection prevention and control? We'd also want to know, when did this person develop their symptoms? Because we go back 2 days before they develop symptoms and then count forward 10 more days that they were at risk. And then anyone that's been in contact with these individuals, if they're going to develop COVID-19, you typically do it within 14 days. And that's a very conservative number. But we monitor everyone's symptoms who would come in contact with the resident or the staff person for 14 days going forward from the time we receive the positive test and or when the symptoms develop for these individuals. We next go back and we want to figure out, how did that person get the infection? So did they travel? What were their exposures? And we'd go back 14 days from the time for the staff person and or the resident. And we want to certainly protect anyone that's been exposed to that person. So who is at risk? So a lot of that is very, very important detective work, taking an appropriate history from all of the individuals involved. And then all of this information is gathered. Our outbreak team, together with the facility, will make decisions about who are we going to test within the facility. And right now we're being very aggressive about testing because we don't want this to spread in any vulnerable population. So we often would test any staff that were on with this individual, and certainly all the residents within the ward where that patient is. But oftentimes, if staff have worked in multiple wards, we would test multiple wards. So the testing strategy is going to be based on our risk assessment, and that's an initial test strategy just to make sure that the virus isn't present anywhere else in the facility. And then we may again test at 5 to 7 days, because that's when some people start to show symptoms. And we may do clearance testing at around day 10 to make sure that we haven't missed any cases within these facilities. And that's been our standard at present. We have an outbreak checklist that we go through, and we work very closely with our long-term care facility partners. It is the duty of the facility to inform the family and or the power of attorney. It is their duty to also inform the public, but we're there to support them as a key partner. And we will help them with risk communication to the public, and we'll certainly help them through appropriate education on how to use personal protective equipment, infection prevention and control measures, and how to limit the spread of the virus within the facility. That's an expertise that we bring to the table, and we've gone through this exercise a couple of times with our long-term care facility partners. It's worked well to date, and we're certainly learning from all the international and national experience of long-term care outbreaks to bring the best practices locally to best protect both the clients of these facilities as well as all the staff.